Yes, John?
Doc,
Yes?
I think it's important to ask about the menstrual history
Yes,
because
why?
in with our abdominal mass that presents with pain, we should
Hmm.
first rule out ectopic pregnancy.
Okay, so you want to um, menstrual period and the previous menses to be able to establish whether she has this period or not. Okay. Anything else with regards to the menstrual cycle other than uh, helping you rule in or rule out ectopic pregnancy? Is there anything else with regards to the menstrual cycle? Yeah. Anyone? Hello. Yes, Joanna.
Doc, in addition po to the menstrual cycle, if we find out where she is in her menstrual cycle via, for example, yung last menstrual period, we can narrow down po our differentials because if we're thinking of physiologic cysts, they would have cyclicity po together with the ovarian cycle.
Okay. Okay. I hope all you have gone through the PowerPoint on this topic that I've uploaded the other day. Um, okay, so I do understand what you mean. Any other information you want to get from this patient other than the menstrual cycle? Anything else? Hello. Yes, Mark.
Doc, hello.
Yes.
Okay, so I want to ask for a family history of ovarian cancer. Since we have a patient presenting with the mass, since there for ovarian cancers there is some hereditary factor to it, so that we can put it at least there's a suspicion if there is a family history of malignancy.
Okay, but what would be in the data given to you that will make you think that it may not be highly probable in this case?
There was no mention of some weight loss.
Okay, but the malignancies in the human body, gynecologic malignancies do not primarily present with the constitutional symptom of weight loss, no?
Yes, Doc.
Okay, so in its absence, you might be misled that thinking that it might not be. Okay. Yes, Mark, you want to
Yes,
say
Doc.
something?
It's also she's young, 19 years
Yes,
old, and also
exactly.
the mass is movable, and so usually for malignancies it should be fixed.
Okay, but can you? Well, yes, of course, generally the masses that are fixed would be speaking of malignancy, but can you name at least one benign condition that is benign ovarian tumor but is commonly fixed?
Um, Wait lang, Doc. Mga movable yan nasa isip ko eh. Um,
Any help from the group? Mark, did you divide the answering of the questions among yourselves?
no, Doc.
Okay, no. Okay. Even if I can see your answer, some of you type their answer you, no, rather than just type. Kasi if you're in front of a patient, you're not going to text to her or type to her, no, your answer. So, someone answered endometriosis. What's that? Someone typed endometriosis, endometrial cyst. Who was Yes, Savina? Were you the one who typed endometriosis? Christopher?
Yes po.
Christopher? Yes?
Hello
Oh,
po.
okay.
Sorry po.
You were the one who answered endometrial cyst?
Yes po.
Okay. So, but how would you differentiate if both a malignant tumor and an endometrial cyst are fixed? What do you think will make you differentiate saying that this is an endometrial cyst, though it is fixed, it is still benign because of the other features that I appreciate on this patient? What could those be?
Welcome po.
In the history, what will make you suspect strongly of endometriosis? Christopher?
Wait.
Danielle, you want to say something? And John? Jacqueline?
Doc, for endometriosis po, I think that the patient would also report of dysmenorrhea po.
Oh, anything else other than dysmenorrhea?
Pain with bowel movements po.
What would be, yes, that would be, what is the correct medical term for that? Yeah, you want to speak up? Yes, Danielle?
Doc, tenesmus for signs of pelvic pressure symptoms are related to pelvic endometriosis like dyspareunia, dyschezia, infertility.
Okay. But those symptoms, you know, what is it in an endometrial cyst that will account for those manifestations? Pressure symptom is different. Like, do you understand?
Yes, Doc.
Oh, those are,
Due to the adhesions, Doc.
yes, of course, due to the adhesions, no? Due to the adhesions, the manifestations of patient referable to endometriosis will not be due to pressure symptoms, but due to adhesions. Okay. So, any other information you want to get from this patient? So, it was mentioned already. Yes, Daniel?
We could also probably ask for other symptoms like symptoms of possible thyrotoxicosis like nervousness, agitation, tremors, excessive sweating, because dermoids can be associated with ectopic thyroid tissue, also called stroma ovari in 2 to 3%, and they can present with symptoms of thyrotoxicosis.
Okay. Possibility, but stroma ovary in itself is not a very common condition, no? It being a component in the dermoid cyst is also not very common. But yes, that would be nice to arrange. Danielle, you want to say something?
No, okay na po.
Sige, kasi kayo. Anyone else? Alian?
Good morning po. I would also like to ask po about if there was any history of fever and or vaginal discharge in the patient, because patients who complain with fever and vaginal discharge with an adnexal mass should be evaluated for a ovarian abscess.
Okay. Okay. Because this patient also presented with a large cyst, anything else you want to ask with regards to that, so to help you come up with a correct clinical diagnosis? Yes? Ayan? Jason?
Doc, maybe I can ask for history of previous appendectomy, Doc.
Okay.
Doc, because the patient experienced right lower quadrant pain, and one of the possible differential po could be acute appendicitis po.
Ah, okay. Okay. Oh, okay. Anything else?
Thank you, Doc.
But you would see on physical examination, you will see a scar. No unincised scar. Okay? Anything else? Any other information you want to ask from this patient? So there's menstrual history, um, previous surgery. Agnes?
Doc, I would like to ask for the sexual history of the patient to
Yes.
rule out sexually transmitted infections that may have ascended to cause the right lower quadrant pain po.
And what condition are you referring to?
Wait po, Doc.
What specific condition would that be?
I would like to rule out po yung mga pelvic inflammatory disease po.
Okay, pelvic inflammatory disease. You mentioned pelvic inflammatory disease and you've had session on upper genital tract infection, di ba? Already?
Yes po.
Can you give me the minimum criteria for making the diagnosis of pelvic inflammatory disease?
There is lower abdominal tenderness and adnexal.
Wait lang.
Po?
The lower abdominal tenderness. The lower abdominal tenderness is due to?
Due to
Because you mentioned the adnexal tenderness. So,
yes po.
adnexal tenderness. Because adnexal tenderness in itself presents as a lower abdominal pain. Okay? So, if you take the adnexal tenderness separate, the lower pelvic pain due to pelvic inflammatory disease. What else would be inflamed?
The
Upper genital tract.
the ovaries po.
Oo nga, adnexal na yun eh. Adnexal tenderness na. Oh, anong bahay nun?
The fallopian tube po.
Patay. Adnexal na rin.
Opo.
Adnexal na din yun. Ikaw naman, oh.
It can be peritonitis po, Doc.
No, yes, of course. But if you make a diagnosis, can you name how many are there for the minimum criteria for pelvic inflammatory disease?
Minimum 3 po.
Oh, what are those?
Lower abdominal tenderness or adnexal tenderness or cervical motion tenderness po.
Hindi or yun, and lahat. Those should be present. Okay? Cervical motion tenderness, adnexal tenderness. Okay? Then, those are very specific. How about the lower abdominal tenderness? Specifically, what structure does it point to as its cause? Wala kaya yata nito eh.
Doc, pwede sa CDC criteria po.
Kaya nga. Yes nga, lower abdominal pain is due to what? I hope you realize it's general. You know, it can be due to anything. It can even be due to a non-surgical like urinary tract infection. No?
Apa.
Pero we are talking of upper genital tract infection. You have adnexal tenderness. Adnexal refers to ovaries. There's cervical motion tenderness. So what else is left that is supposed to be inflamed in pelvic inflammatory disease?
The uterus po, Doc.
Okay. The uterus. Okay. Jan and Jackie and Gwendolyn, but I want to hear you kasi nahihirapan ako makipag-usap sa monitor, no? Okay. So, any other question you want to ask from this patient? Vanessa?
Yes, hello po, Doc. Good morning po.
Morning.
I would like to ask if she first started to notice a mass, because if she noticed it was just if she noticed it recently, then that might have meant that the mass was rapidly growing. So chances of it being malignant is more likely.
Okay, because of her growth. Okay, generally, that would be
Yes,
the
po.
progression. Okay. Okay, anything else? Well, at least most of you have the same answers. Wait lang. First one. Okay, the last menstrual period, because that will help you. It was mentioned whether it would be as physiologic or pathologic. Okay, cyclicity of pain. You need to know that timing of menses, that will be correlated to the first one. Sexual history. Okay, although it is here that the patient has an intact hymen, doesn't necessarily mean that she did not have previous sexual contact. Okay, and you know that it would be important, as what mentioned earlier, and a consideration of ectopic pregnancy. In this case, the progression of the mass, if it is benign, should be slow growing. No, so you would need to ask the patient when she first noticed it, how big was the mass, how it felt, the consistency of the mass, was it so cystic, and did test from that time on. Okay, previous surgery, but equally important are the following data. Wrote here allergy to seafood, hypersensitivity to drugs. Why do you think did I include those? Anyone? Allergy to seafood and hypersensitivity to drugs? Anyone? Vanessa, you want to try? Hello?
Hello.
Sige na, let's maximize the time. Sayang eh.
I'll just try po, Doc, regarding the drugs. Maybe because sometimes if patients take drugs, sometimes they with abdominal pain. So maybe she could have taken any drugs recently that result in the patient's abdominal pain.
But then, can you name at least one specific drug that may cause abdominal pain as its side effect?
If I remember correctly po, antibiotics.
Be a little more specific.
NSAID. Wait, what's more specific?
Eileen, you want to try?
Azithromycin.
Azithromycin. Well, lahat naman ng drug abdominal pain as its possible adverse effect, no? But it is not very common, as you should know by now, especially at the time. Azithromycin is commonly used for the COVID.
Yes.
Any other hypersensitivity drug? Remember, don't take this just as is. Take this in context with what the patient. Yes, Joanna.
Doc, try lang po. Maybe it
Yes,
would
always.
be in relation po to PCOS, because a lot of patients with PCOS present with food allergies.
With food allergy.
Seafood allergies po, and they can exacerbate the symptoms of
No, I don't think that's right. Lian?
okay.
Lian?
Doc, yan po. For the allergy to seafood, we can think of gastroenteritis as differential because allergy to seafood may lead to that, and it can and gastroenteritis can lead to lower quadrant pain.
Okay. But then, yes, of course, that is a possibility. But then, if that was what happened, I told you, that it would be already elicited in the history, no? But then, sige, if patient missed saying, then yeah, you can ask that. Okay. So, sige, no? But the reason why I include allergy to seafood and hypersensitivity to the drug is not because I'm going to feed her or give her seafood, no, but because my impression in this case would necessitate a surgical procedure. Therefore, I need to know this thing because it will affect on how, what drug I can give to this patient safely. For the seafood in relation to surgery, can anyone tell me the relationship? Yes, Jose?
Doc, allergy to seafood be related to having hypersensitivity reactions to diet po, yung iodine containing diet po.
Yes, but in surgery, we don't usually use the dye. What surgery are we using that is related to seafood that has that iron content? No, not allergy to ha? Not allergy to anesthesia. Ano yan, Jose?
Antiseptics po or
Antiseptic. Yung antiseptic na yun.
iodine.
Okay, okay. Latex is not, no? Wala namang seafood na made of latex. Baka, yeah, I don't understand, baka the that will be used for, no? But rarely does the react. Okay. So, the next question. I think most of you got this. I went through your answers already. I did not include this specifically, and this is specifically in the PowerPoint slides I uploaded because I want you all to be able to differentiate physiologic from the pathologic. So it has been mentioned already. Cystic humor for pathologic and pathologic, although that would be the general, not necessarily always. No? Can anyone else differentiate physiologic from pathologic? Yes, Claude? Ba, malagi si Claude.
Hi, good morning.
Morning. Oh, sige.
Physiology po, it's develops the cycle. It's hormone dependent for yung follicular corpus luteum cyst. Compared to pathologic, that is independent menstrual cycle, but sometimes it could be still dependent. For physiology, it could continuously resolve. Pathologic, it needs intervention. Loss is usually more interested in pathologic than physiologic. Tapos, with mobility, doc, dito, it's usually mobile sa physiologic and more effective when it comes to pathology because it adheres to adjacent structures. Po.
Okay, wait. But please take note that this is just physiologic and not malignant. Can you be a non-physiologic ovarian cyst but benign?
Non-physiologic but benign.
Yes, benign. So you mentioned so hindi na siya corpus luteum.
Dermoid cyst.
Dermoid cyst. You see, a dermoid is unlike what Claude said earlier, di ba? It is pathologic, but it is commonly not fixed. No? What was mentioned earlier, benign and fixed, is the endometrial cyst, di ba? Okay. So,
Teratoma din po ba?
yes, that's the of the dermoid cyst, the teratoma, no?